My name is Mike Rice. I'm the Education Director for MTE, and in this short video I'll be going over some of the frequently asked questions about the Movement Therapy Diploma. We get questions all the time from people that are a bit stuck professionally or feel completely overwhelmed with all the options of courses to qualify as a sports therapist. They often want to start a new career or broaden their knowledge but don't necessarily want to go to university. As a teaching team, we took the steps to make a completely different course to what is available and break the mould of therapy education. Traditionally, the only way a therapist could gain higher qualifications was to work their way through the ladder from level 3 to level 5, and the qualifications are mainly focused on soft tissue therapy. There are some excellent soft tissue courses out there, and we would highly recommend our friends at the school and Anna Maria and her team, who deliver a soft tissue therapy course at level 5 out of Exeter and Bristol, if you specifically want to be a soft tissue therapist. The Movement Therapy Diploma is different. The diploma has been a course in development for the last 15 years. It started off as a level 4 sports therapy course, but we always wanted to give more for our learners. We started to write lots of CPD training for them. We did neurological testing, pathology for therapists. We looked at functional movement screening and taping and cupping courses because our learners always wanted more information so that they could upskill. So we then decided to put all of those courses that we'd written all together to create the diploma. The diploma has been heavily influenced by researchers such as Lorimer Moseley, Greg Lehman and the late Louis Gifford. From the very first day, we introduce our learners into the world of pain science and how they can use that knowledge to better help their patients understand their own symptoms. We have, over the last 10 years, seen a big shift in therapy education away from the traditional patho-anatomical approach where it was thought that things like poor posture causes pain. And now we're into a much more rounded approach where we consider the person as a whole, their lifestyle, their work, their training volume, and all the other factors in life that may influence the way that someone feels. As a teaching team, we've delivered education throughout the world, and wherever we've taught, we've seen a gap in the knowledge between sports therapy and soft tissue therapy and the clinical world, and we wanted to try and close that gap. Our tutors all run clinics. We are face-to-face with our clients and patients every week. We don't just read the research, we have to come up with ways to implement it with real people in real life. We will tell you stories about our failures as well as our successes, as we believe that you have to learn from both, and we want to pass on our experience over to you. Our diploma does not allow you to diagnose. Diagnosis is a skill that is only allowed to be offered by clinicians that are members of regulated professions, things like the HCPC and GOSC for osteopathy. Unfortunately, the sports therapy industry is not regulated. Many soft tissue therapists come to us saying that they're frustrated because they only seem to be able to take their clients so far and then have to refer them on to another practitioner. With the extra skills that the diploma will give you, and more importantly, the deeper understanding of what you are doing, you may actually refer that individual sooner, or come to the conclusion that based on your assessments that we will teach you as you go through the course, you are able to help that person because you have been able to justify your treatment approach. We want to make sure that you are an excellent therapist who is able to clinically reason and establish a sound working hypothesis. These new skills and deeper understanding will mean that you will be able to communicate with clinicians in a far more effective way. I mentioned before about the other qualifications that are available, and we often get asked what the differences are. Well, the Movement Therapy Diploma is 3 years long. And whilst we cover the techniques such as METs and STRs and positional release, that is just 10% of what we deliver. The other 90% is focused on the depth of your understanding. So why you do a certain technique, when you do it, why you use it and when you might not. What is the evidence behind that approach? We enable you to fully justify your chosen approach in a sound, evidence-led way. Our first module is all about research skills, how to find relevant research papers by effectively searching the medical databases. The research databases can be completely overwhelming unless you have the skills to use key search terms to narrow down your findings. And then when you finally do find a paper, it seems to be written in a language that you're completely unfamiliar with. So you feel out of the loop when all you want to do and all you're trying to do is help your clients and improve your own knowledge. Some of the most positive feedback we've had from the whole diploma is the fact that our learners now feel confident in searching for, reading and critically analysing a research paper. Throughout the 3 years, we teach you in-depth anatomy and pathology for every region of the body and how to spot the signs of potential red flags. Now, red flags are often covered in a lot of other training courses, and they usually ask the client if they have a certain medical condition. But what if they don't know they have that condition? What if they've had a problem for months or years and never really sought to get it checked out because they thought it was just a bad back? We have a systematic and thorough screening protocol that we call our safety net, which will help you sift through all of the client's signs and symptoms to help you decide whether they need an immediate referral. Again, we can't train you to diagnose conditions, but what we can do is train you to become the safest therapist possible. You will learn clinical skills like neurological testing, and we have modules in medical imaging and pharmacology. And throughout the use of case studies, we help you hone your clinical reasoning skills so that you think the same way that a clinician would. There are 25 modules to the diploma, and they are split into 4 phases. Each of the phases must be completed in order. The course dates run like a menu, so when you join the course you'll be given access to our online portfolio, and this contains our learner booking system. You choose which dates to attend and when, and if you can't make a date, it's not a problem. You just cancel your booking and then rebook on to the next one. We want to make sure that you're the most well-prepared therapist that you can be when you graduate. And that is why we allow you to resit any day as many times as you like throughout the 3-year duration of the course. Our course is fully endorsed by the Sports Therapy Association, and upon completion you will be able to graduate as a full member of the STA. I hope you found this video useful. We've tried to highlight the main questions that we often get on the course. If you have any further questions, please don't hesitate to get in touch. Thanks.